As a professional driver, you're on the front lines of the global COVID-19 pandemic. You keep goods flowing to stores, hospitals, and other critical businesses. Your job is always important, but never more than now. This course will give you the information to keep yourself safe and help stop the spread of COVID-19. You'll learn about the symptoms of COVID-19, how it is spread, and how to protect yourself and others. We'll cover specific ways the pandemic is affecting drivers and provide you with helpful online resources that will have updated information on this fast-moving situation. Doctors are still identifying symptoms of COVID-19, but the most common are fever, persistent dry cough, shortness of breath, chest pain. What should you do if you have any of these symptoms? If you're on the road, you need to contact your dispatch team. Like any other medical emergency on the road, they have a playbook and they will help you. If you're already on home time, contact dispatch and stay home. In both cases, you'll want to contact your healthcare provider to start care and get tested. While most people who get COVID-19 have mild to moderate symptoms, about 20% need to be hospitalized. Hospitalization is a higher risk for those over 60, people with diabetes, lung or heart issues, or people with compromised immune systems. COVID-19 is both robust and highly contagious. The main way it spreads is through respiratory droplets sprayed when someone who is infected coughs or sneezes. The virus can survive on surfaces for hours and even days, so you can catch the virus by touching your own mouth, nose, or eyes after touching a contaminated surface. So, let's talk about prevention. First, wash your hands often with soap and water for at least 20 seconds. You should try to do this anytime you've been in a public place, or after blowing your nose, coughing, sneezing, or touching any potentially contaminated surface. If you don't have soap and water, like when you get back into your cab, use hand sanitizer with at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Finally, cough or sneeze into the crook of your arm rather than covering your face with your hands. We've all now heard the term social distancing. That means limiting physical contact and proximity with other people as much as possible. You should avoid groups and minimize visits to public places like grocery stores and restaurants. If you must be out in public, try to keep at least 6 feet between you and other people. Let's talk about specific ways you, as a driver, can stay safe and stop the spread. Whenever you switch trucks, use bleach-based wipes to clean door handles, steering wheel, ELD devices, turn signals, wipers, dashboard controls, shift lever, sleeper berth surfaces, handles. When you're out of the truck, you should wash or sanitize your hands after touching anything, but specifically high-touch areas, like fifth wheel and landing gear handles, trailer door handles, fuel pumps, any desk or countertop, public facilities door handles, pallet jack handles, phones or handheld devices, cash, paperwork and pens, driver lounges and public computers, break rooms, except for hand washing, vending machines. Part of the FMCSA's reaction to the pandemic and its economic fallout has been exemptions to some of the regulations. You may be exempt from HOS rules if your load provides direct support to emergency relief efforts related to COVID-19. Check with your carrier before using any of the temporary exemptions. Exemptions have been given for medical loads like pharmaceuticals, supplies, and testing equipment only if they're directly related to COVID-19. The exemptions have also been applied to hauling critical supplies like food, paper products, groceries, or PPE like masks and gloves. For food products and grocery deliveries, there are rules to exempt normally commingled loads of food and other products. All fuel types being hauled are also included in this temporary exemption. If you are unsure if you are exempt, check with your operations team to determine what type of load you're hauling. If your CDL or medical certificate is due to expire, the FMCSA has extended the expiration deadline to June 30th, 2020. Drug and alcohol testing may also be delayed. If you have COVID-19 related concerns about testing, you should discuss them with your employer. Your company must investigate and will likely set up alternate testing. Hazmat regs, vehicle size, weight rules, and insurance requirements all remain in force. Let's switch from regulations to operations. The pandemic has caused both a shortage of warehouse workers and complete business closures due to social distancing. While checking with your operations team, ask about a backup plan in case of shipper and receiver delays or closures. Your company may issue you an essential employee or shelter-in-place exemption letter. You may be asked to produce this at any border crossing or during a roadside inspection. Most restaurants across the country have been reduced to carry-out or delivery only. That will limit your access to roadside services for fuel and food during this outbreak. Most truck stops know you've still got a job to do. The big ones, Love's, Pilot Flying J, and TA and Petro, are all open with food, fuel, and showers, though most of the dining room seating has been closed. Some states have also closed some rest areas for parking. Be sure to check individual states for closures. Lastly, the Canadian and Mexican borders have been closed to non-essential traffic. Truck traffic is currently exempt. However, because temporary business closures and shelter-in-place orders have happened recently with little notice, you should work with operations to verify the customer will be there to load or receive. You already know how important it is to stay alert as a professional driver. In these challenging times, it's more important than ever to watch out for fatigue and distractions that could affect your safety and others. With everything going on, your mind may wander, and you may find it harder to sleep. So, be aware of fatigue and signs that you're becoming sleepy. If you're tired, park in a safe and legal place to take a break. And remember, you still need to take required breaks as part of HOS regulations. Beyond feeling fatigue, you may feel more distracted than usual. Given the situation, it is normal to worry about your family, finding a place to park, and the turmoil on the news. While you can't control what's happening in the world, you can control your reactions to it and stay focused on the road. Other drivers around you might also be more distracted, making it vital for you to maintain focus when you're behind the wheel. There are several up-to-the-minute, reliable sources for information on COVID-19, including the CDC and FMCSA. Your own company, too, is committed to your safety. We strongly recommend you check in with them regularly. This is a new situation for you, your coworkers, and the whole world. But we can get through these difficult times by remaining vigilant and taking pride in our vital role of keeping the nation supplied during these times of need. Thank you for all that you do